Hi, my name is Dr. Covington. I am the owner of Abundant Health and Vitality Associates here in Charlotte, North Carolina. This is a medical weight management clinic, and I do weight loss full time. I am a board certified internal medicine doctor and bariatrician. Bariatrician is basically a weight loss doctor. So today I'm going to talk about the most common mistake that patients make with phentermine. Why am I talking about phentermine? Because it is the most commonly prescribed weight loss medication in the United States. It is one that I use quite often. It's a medication that's been around forever. It's been around since the 1950s. And it's pretty effective when it's used for the right person. So there's a lot of people who have taken phentermine, who are currently taking phentermine or interested in phentermine. And I would like to help you avoid a very common mistake so that you can have better results. If you're one of my patients taking phentermine, then I already go through all the things that you need to know about the weight loss process and medication process. But for those of you who are not my patients, this is a way for you to get some additional information so that you can have really good results if you are taking phentermine. So phentermine is a FDA-approved weight loss medicine. It's in the amphetamine class. I have a whole video devoted to phentermine, how it works, side effects, how it works for weight loss. We also have a blog on our website that talks about phentermine as well. So I'm not going to get into a lot of the background with it. The video will be linked below on YouTube, but it is a weight loss medication, and its primary effect is to suppress your appetite. It also helps with metabolism. So in the process of suppressing appetite, a lot of things happen. People make better nutrition choices. They eat less, they have smaller portions, they're obsessing less about food, so they may go longer stretches without eating. They have less food that is higher calorie, or just random food. You know, if you're really hungry throughout the day or you're always thinking about food, you just eat random things that add up on the scale. So it is an appetite suppressing medication. It's also a medication that gives you energy, so people have more energy to exercise. They're not as tired, they're not as fatigued. They get more personal things done throughout the day is one of the effects that my patients tell me about. You know, now when I get home, I'm not sleeping on the couch. I'm able to get up and actually do stuff. And of course, the more active you are, even outside of a defined exercise, the more active you are, the more calories you're burning, and people lose weight for that reason too. So although it is an appetite suppressing medication, one of the most common mistakes that people make with phentermine is they don't eat. There is a difference between making better nutrition choices, eating less of the wrong things, and not eating. The medication can be strong enough, especially in the beginning, and also for certain people, to where their entire appetite is taken away. You know, they may go an entire day and not eat. They may eat just once a day or twice a day or go several hours without eating. That is one of the worst things that you can do with phentermine. And there's a couple reasons why. The first reason is because you need nutrition. You need proper nutrition. You need the right vitamins, minerals, macronutrients, in order for your body to function properly. The medication may make you feel great in the beginning, but over time, if you start to develop nutrient deficiencies, you're going to feel really crappy. You're going to feel fatigue. You know, you're not going to look as good. You're not going to look as healthy. Your skin's not going to glow as much. You're going to lose, you know, all the things that come with proper nutrition. Because you're not getting it. So one is nutrition. You still need proper nutrition for your heart to work properly, for your brain to function properly, for your body to do all the things that it needs to do on a daily basis. So not eating can lead to improper or poor nutrition. The next thing that happens is that in the beginning, you have a stronger appetite suppressing effect. And if you are just not eating at all, eating one meal a day, let's use that as an example, and one small meal a day, you may be able to do that for some time, but as you continue on the medication, you become less able to do that. The less you eat on phentermine, the more you are going to increase cravings and hunger in the future. So what happens is people get these huge numbers the first month. Oh, I lost 40 pounds in a month. I lost 30 pounds in a month. I lost 20 pounds in a month. And then a couple of weeks after, they don't lose any more weight and they start to gain weight. Why is that? If you're not eating, your body's going to recover those calories. It's going to recover that fat that you lost. And because you lost it the wrong way, it's going to have an easier time recovering that. If you're not eating properly, you're also not going to be preserving your lean muscle. Which, when we look at the macronutrients, the macronutrient that we do that most with is protein. If you have poor nutrition, I can pretty much guess that you have a poor amount of protein or a poor source of protein. So if you're not preserving the muscle mass, your muscle is being reduced, and you're making it easier to gain back weight because your basal metabolic rate is coming down. So basal metabolic rate is the amount of calories that you're burning 24 hours a day at rest, so not doing any exercise. And everybody has a number that they burn calories for. So if you're not eating, you're reducing your nutrition, you're reducing your muscle mass, and you're increasing your cravings and hunger in the future. And when we take Phentermine, one of the things you have to think is think long term. Don't get so infatuated with the scale and seeing big numbers in the beginning that you're not thinking about what's going to happen a year from now. What habits am I introducing or teaching my body that are going to be sustainable a year from now, or 2 years from now, or 3 years from now? So not eating will get you into a lot of trouble, not only because you're more likely to gain all the weight back, but because you cannot maintain not eating for a long period of time. It doesn't matter how long you take Phentermine. Eventually, if you do not eat, that effect will wear off. What you want to do with Phentermine is you want to have proper nutrition, and you want to be sure that you're going to a clinic that is comprehensive enough that they're taking the time to teach you about proper nutrition. What we do in our clinic is we electronically monitor everybody's nutrition, at least for the first 4 months. So we look at every single thing that they're eating, and we make recommendations based on macronutrients, but also some of the food choices. We do not turn patients into calorie counters. That's not the purpose, but for them to learn about their food and also eat the most nutritious foods. So you want to be sure that you're going to a place that's comprehensive enough to where they're not just giving you a prescription for Phentermine and sending you on your way, but they're going through the nutrition with you so that you can build long-term habits that are really going to benefit you in the future. With your nutrition, you want to be sure that you are eating throughout the day. And there's a couple different ways to do this. What I recommend for a typical patient is that you do eat breakfast. You take the Phentermine when you wake up, first thing in the morning. You eat a breakfast sometime within the hour, and that you try to eat every 4 hours. Whether people eat 3 times a day or 6 times a day is personalized based on that patient, but at least eating throughout the day at least 3 times a day at the very least. That's going to keep your glucose levels level throughout the day. It's going to keep glucose from spiking and peaking and spiking and going up and down and all over the place, which is going to also increase hunger and cravings. And it also keeps some routine and some consistency in the way that individuals eat. If you're eating well one day and you're eating poorly another day, that's not a very effective way to lose weight long term. You want to be consistent in what you're doing every single day. So let's see, is there anything else that I want to say about that? So not eating is bad on Phentermine. Resist the urge to do that. Yes, it is suppressing your appetite, but you should still be eating. That does not mean that you eat things that are bad or that you have to eat a lot. You should be eating wholesome nutrition, good amounts of protein, healthy fats, complex carbohydrates, avoiding things that are processed, high in sugar, and avoiding things that are just really not going to help you with your weight loss efforts. So I hope that this was beneficial. The other thing I want to say really quickly, and I try to say this whenever I talk about weight loss medications, especially Phentermine. Phentermine is not the only weight loss medication on the market. It is the oldest. It is one of the cheapest. Actually, it is the cheapest. And we know that it is effective, and for the most part, for the right patient, it can be pretty predictable. However, Phentermine will not work for everybody. And if you're going to a clinic that only prescribes Phentermine, you're at a disservice because there are other medications that may be better suited for you. So it's not the only medication. There are at least 8 FDA approved weight loss medications, and in our clinic we use all of them. We use everything to our full disposal, and we make sure that we target the right medication to the right patient. So don't skip eating. Don't not eat on Phentermine. Eat healthy, eat wholesome, eat throughout the day. If you can't eat a lot, that's okay. Eat a small amount, eat a small portion. That's going to help you long term. Good luck, and I will see you. That was my ice maker. I will see you soon.